to you about just two cases, XTR and NTR clips, since they're the two clips available in India. The MitraClip NTR and XTR clips are different in length, where the XTR clip is about 3 millimeters longer, which allows a better grasp and expands the number of cases that you can be treated. But it is important to know when to use what. So these are recommendations that we say that if you have a large leaflet or prolapse and flail, favor XTR. If you have a smaller valve area or functional MR, favor NTR. So this is a gentleman who was 67 and had a combination of functional and degenerative MR, a burnt out DMR. As you can see here, the leaflets are pulled apart. The ventricle is very dilated and EF is 38%. You can see here there's a flail of the posterior leaflet with a very large gap. And this was impossible to be treated by an NTR. The PA pressure was grossly elevated, and he was turned down for mitral valve surgery because of low EF, severe PH. He was turned down for cardiac transplant because the PVR was greater than 9 minutes. He was turned down for MitraClip NT because of the wide gap. So we use this as the first patient of using the MitraClip XTR. So this is the left atrial pressure. As you can see, it is severely elevated, which is about 36 V waves, mean of 19. This is the flail posterior leaflet, but there's a very wide gap in the middle, which would be difficult to bring together with a MitraClip NT. So we decided to use the long arm, and we wanted to put one stabilizing on the medial side and then put a second one in. So we managed to get the first clip a little lateral. We grasped the leaflets in the first attempt, and we closed the clip, and there was quite a good reduction of MR with just a small jet on one side. And then we put a second clip, and then after putting two clips in, we got a great result. So this is an example of using an XTR clip for the treatment of a flail plus a gap. And this is the left atrial pressure. It dramatically dropped with no V wave almost. And this is the 12 months later, patient's symptoms have dramatically improved. And you can see over here, just a small jet in the middle. The next case is a case of NTR, is an 84-year-old lady with shortness of breath with chronic atrial fibrillation. And over here, what you notice is an eccentric mitral regurgitation. And the reason for that is a small tethered posterior leaflet. And the leaflet is small. So in this patient, an XTR would cause more damage. The leaflet length is less than 9 millimeters. So we thought we'd use an NTR. And so we decided to use an NTR over here. You can see the leaflet length is very small. And so we used one NTR. We grasped the leaflets. You can see a lot of smoke in the left atrium, which means that the MR looks quite good. And we deployed the clip. A good leaflet insertion over here suggested that it would not lead to leaflet detachment. And this is what happens with the left atrial pressure. It keeps dropping as we grasp the clip, and the aortic pressure keeps going up. This is a classical phenomenon that we see when we treat MitraClip for MR. So which clips to use? Just remember type of pathology, leaflet, length of leaflets, mitral valve area, and region of pathology. So if you type pathology, if you're flail, a large flail, consider XTR. If the length is less than 9 millimeters, consider NTR. If the mitral valve area is borderline, consider the smaller clip. And if the pathology is more commissural, then definitely use the smaller clip. If it's central, you can use either NT or XT. So my conclusion is that the third and fourth generation MitraClips have improved efficacy of the procedure without increasing adverse effects. Wide group of mitral pathologies can be treated. These improvements are helping the MitraClip to become the first-line treatment of MR, not just for surgical rejects. Thank you very much.